Hello, Dr. Ahadian here. Wanted to discuss Parkinson disease and the relationship between the Parkinson disease and impulse control disorder. Now, impulse control disorder is a topic by itself that has to be discussed, which is a condition that there is problems related to controlling the impulses that one would have with regard to daily activity and daily life. This kind of situation, basically pathology of that and the problems that's being seen is in gambling, in obsessive shopping, in issues with regard to somehow manic episodic behavior of impulsive behavior, sexual impulsive behavior, mostly related issues as such, and drug abuse and stuff related with mostly impulsive behavior. Now, in this kind of problems, it's been seen that people who suffer from Parkinson disease, which is a problem related to movement, behavior, and physiologic movement and movement of the body, in which we have rigidity of certain muscles, problems with regard to movement and moving when the patient suffers from the relationship between the orders that are coming from the brain to the muscles and to the limbs in order to behave with the orders getting to the limbs, and therefore we have tremor, which begins early in the disease, and sometimes you see, like, when people get their hands out, there is a fine tremor, and it exceeds itself to problems related with movement. And then we have a condition like a masked face, there's no impression to it. Basically, movements are being affected. Now, there is a relationship with impulse control disorder, specifically pathological gambling, with related disorder of Parkinson disease, which is important to keep in mind, that everybody who's going to gamble is not going to begin to have Parkinson disease. However, there is a connection between that, which is interesting to discuss about. Now, treatment of the impulse control disease, we don't want to go through treatment of the Parkinson disease and using L-Dopa and the drugs as such, because it's going to become a very different discussion related to issues with brain and neurology, and mostly people who have Parkinson disease go to a neurologist and follow up with that. However, in Parkinson disease, we would have problems related with mood and affect, with severe depressions, with problems related to adjusting to the Parkinson disease, to adjusting to the losses that the patient has gone through with regard to loss of movement, loss of ability to deal with day in and day out in life that the patient has been going through. However, the impulse control disorder part of that is very interesting to me, and I wanted to share it with you, and basically how to deal with these impulse control disorders. One of the best ways to deal with that is, first, is to diagnose the problem, to find out and to see, to make a diagnosis that this disorder exists, because the impulse control problems is mostly inherent in a lot of other syndromes and problems and disorders. For example, borderline personality disorders. That is a I have discussed, I had a discussion prior to today's discussion in one of those YouTube videos about borderline personality organization, borderline disorder, in which we have a lot of problems with impulse control. that activities are based on impulses. We would see that. We would see in manic disorders and manic depressive symptomatology and disorders. Also in bipolar disorder, we see a lot of impulse control problems, which then we come to the treatment of the impulse control, which has to be dealt with psychotherapy, with medication, with control issues, with environmental activities, and looking through how each person is behaving through his or her environment, with the genetic factors, with the family and inherent factors throughout the genesis of a individual. Mostly the obsessive part and pathological gambling part of that could be looked upon and treated as a obsessive compulsive disorder and obsessive compulsive personality organization, with the repercussions of that, which are the depressive disorders. Medication used for that are high doses of antidepressants, fluoxetine. One of them in high doses has to be used. One of my patients was asking why it has to be high doses of antidepressant, and basically in order to deal with the mechanism of action of the problem that is caused by the obsessive compulsive pathology, the dose of the serotonin reuptake inhibitors has to be higher in order to be able to have an effect on the pathology of the obsessive compulsive disorder and pathological gambling. And basically then the impulse control disorders are a very interesting concept, which has to be dealt with and worked through and looked upon in a very big picture, and not to be just only focused on the specific signs that are being expressed, but the whole human being and the relationship of the human being to his or her environment. And one of the other interesting factors was the relationship between the Parkinson disease and impulse control and relationship, and seeing a lot of pathological gambling in people who suffer from Parkinson disease. And again, I just want to make that clear, that whoever goes and gambles does not mean that he or she is going to suffer from Parkinson's disease. This is a very interesting combination, but it's not always directly related to each other. Thank you very much.